Baker wants more kids in classrooms, even as the number of new COVID cases in Massachusetts accelerates. Here to explain the risks is Dr. Kristen Moffatt, an infectious disease specialist at Boston Children's Hospital. Good to see you.
Good to see you too, Emily.
So we've talked before about a sharp increase in new COVID cases for people under the age of 20. Have you seen a surge in patients? Do you have the resources to handle something like that right now?
So the number of cases in children is certainly rising, but it's rising proportionately with the surging numbers of cases that we're seeing across the nation. Children account for about 11% of COVID cases, and this is a number that's been holding steady for several weeks now. But luckily, children still only account for about 1 to 3% of COVID-related hospitalizations. And that very much aligns with the very low number of children that we're seeing that require hospitalization for this infection. So we are seeing more cases. Most of them can be handled safely at home, but we are ready and prepared with the resources that we would need at our hospital in the event that there were a surge in pediatric hospitalizations too.
That is really good news and seems to go along with what we're seeing from the schools. They seem to be doing really well. Just 75 infections so far from 30 clusters. COVID is spreading fast, though, through a lot of communities. Is this the right time to bring more kids back to school?
Yeah, the available data so far do suggest that transmission in schools is relatively rare. And when cases are occurring in students or in teachers, they by and large are associated and acquired with exposures that are occurring outside of school, so in their community or in their household. So we really need to keep in mind that the goal of both keeping kids in school and getting more kids into school that have been full remote will rely heavily on our ability to have sustained community-wide transmission control. So the highest chance of success for this will really be if we all stay vigilant with all of the risk mitigation measures that we've continued to practice.
So to that point, we know that indoor gatherings are a big source of the infections that we're seeing right now. A lot of experts worried about Thanksgiving. Do you think it would make sense for schools to go remote for a few weeks after the holiday, just as a precaution to try to slow any spread?
Again, the safest way to control transmission in the schools is to have good control over community transmission. So when it comes to Thanksgiving plans, every family really needs to keep this in mind, and they need to keep in mind the consequences for their children who are school students if they are planning get-togethers, gatherings, or activities that increase the risk of exposure. In terms of preemptive school closures to theoretically reduce this spread, I'm not really sure how effective that would be. K through 12 schools are relatively controlled environments with strong measures in place to reduce transmission, and activities that students may take part in outside of school if they were out for 2 weeks may actually be higher risk. So probably the safest approach would be for families to really keep these risks and these consequences in mind when they're making their Thanksgiving plans, and make their plans as if the chance of their children staying in school safely depends on it, because it does.
Yeah, great advice. All right, Dr. Moffatt, thank you so much for your time and for your insight every week. We really appreciate it.
Thanks for having me.